We will move on to the next presentation on CanAIRy Alert. Dr. Beatriz is responsible of maintaining the program of One Atmosphere in WRI, which is part of the comprehensive action plan for the environment. Beatriz has as a mission to promote air quality with various cross-cutting programs and initiatives. She works closely with air quality teams from WRI, India, Africa, and Indonesia, and she coordinates the air quality efforts in Mexico and Colombia, and she is also the director of the CanAIRy Alert program. Thank you very much, and I'll try to be quick as well. So these two presentations, as I said before, the purpose is to identify tools that once we analyze them can become available. This is the first one, and it has to do with air quality forecasting. If I ask you, how important is it for you to know not only whether in the next day or in the next hours we are going to have high temperatures or bad air quality, perhaps we can take some measures to reduce our exposure, and depending on our sector, we can let population know to implement a preventative action and also to think about how to reduce exposure. Oscar talked about exposure to heat, and we also published a blog post around the link between air quality and heat. Many of the deaths reporting for air quality are not considering the previous exposure of people to heat conditions. So high heat conditions are very related to bad air quality. We know that people with greater vulnerability also have greater exposure to bad air quality, bad heat waves, and this is a deadly mix. Heat is also making it possible for more emissions to happen. So these tools to know how the air quality is going to be are critical. Next slide. This is a report that I'm sure that you already know. This was published this year. This is the global state of air quality, and there's a very important section around children's health. And I think that this is very related to our previous discussion. How do we make it so that these initiatives, like the one that Oscar presented, protect children and other vulnerable populations? So in the face of this problem, we have several tools. And the first one that I want to talk about is models. Models that allow us to understand air quality in the next few hours or next few days. And we already saw a similar model with particles. This one is very similar. This one visualizes a GOCF NASA model. This would give you information about what are the air pollutants, marine aerosols, or powders. And here we can see how these air masses can reach the Caribbean, but also even here. This is another similar model that makes a visualization of the model, but only for a zone. And I think that if you click on it, the only thing that you can do here is that. So the fact is that there are tools already available to know what the air quality is going to be around ozone or other particles. But the question is, if I'm in Monterrey, how do I download the data without being a super expert or technical expert? And that's what we aim to do with CanAIRy Alert. NASA is providing this information, and this is a very powerful model that provides a forecast for the next 4 days. And they analyze this for the whole planet. The resolution is not as small. This provides 25 kilometers of data, but in those 25 kilometers radius, you can get nitrogen, ozone, PM 2.5, etc. So the big question was, how can I use these available tools and use it as a decision maker, for example, if I'm working in a specific city that wants access to this data? And a very nice thing about this model is that the chemical model is fed by a meteorological model. And this one has an update twice a day. And the meteorological model provides data around temperature, humidity, and precipitation. So if we could bring that slice of data to Monterrey, for example, so that they know, for example, the forecast of nitrogen, PM 2.5, ozone, temperature, and precipitation. And this is exactly what we were looking for. So after a long time, we've been collaborating now with NASA, and we told them that we wanted access to that data. But not only that, we found that if the outputs of the model are compared with the data of the monitoring network of the metropolitan area of Monterrey, we can create a machine learning model, and we can say, okay, let's model that for Monterrey. But how do I know how is it being actually locally measured in Monterrey? So what we can do is we can adjust the forecast based on what is measured on site. And this is a bias corrected forecasting model. And this is of greater quality, of course. There's a lot of effort behind that, of course. But it is actually quite easy for the Metropolitan Area of Monterrey to have access to this forecast data. If I wanted to have access to a forecast like this, I would have to have a group of experts, maybe with 200 computers, to run a model like this one. And this is something that you can do. So we've done a collaboration with cities. We asked various cities whether they were interested and whether they could provide the data. And once the model is ready, are you willing to use it? Because of course we can have wonderful tools, and if no one is actually using them, what's the use? So as you can see here, if you click on all of those dots, are the monitoring stations for which this adjusted forecast has been done. I know it's not very readable here, but the forecast is for the next 5 days, PM 2.5, ozone, nitrogen levels. And what we've seen with this last season is that the temperature forecast is actually very good. This is something that we've seen. We have not assessed the performance, but we did this in Mexico City, Monterrey, and I forgot the other one, but where we really saw good data, I think it was Guadalajara, but what the forecast was showing was really good with the actual measurements. What we knew already is that heat waves create high levels of ozone, and this is also shown in the forecast. So this is what I showed you about the data that we use. The NASA model is adjusted, is corrected based on machine learning. You send this data to an API and you can see it only in this platform. But also the authorities of cities can download this data and run an analysis or even publish them. Let's move on to the next slide, please. So we have been identifying which cities could be interested in using this. We used this program in CanAIRy Alert last year. Gerardo was also participating in these meetings where various representatives of cities that are interested in using this forecasting model would come in and tell us whether it worked for them. And the last one, for example, was in Mexico City, where all of the monitoring stations were integrated and a forecasting model was generated. What we found as well is that we have this wonderful tool. It sounds like a lot of people could use it and get a lot of benefit. Why not train users so that they can not only share experiences, but also tell the developers of these tools what works for them or not? So we've organized a community of practice for this purpose. We can share all of the videos, all of the materials that are already created. And in the next slide, we are hoping to start a new session of this project, but all of the sessions that we've had so far are recorded. Everything is in Cities Feeds Learn, which is a learning platform where you can go in and watch those recordings. So if you'd like to see this, currently we have 5 stations from the Metropolitan Area of Monterrey. When we did the adjustment, we didn't have enough data with all of the modernization that is being done to the network, we hope that in recent years we can have this model for each of the monitoring stations that provide a forecast. Yeah, this is City Fix Learn, and it's very easy to find CanAIRy Alert there. If you'd like, at the end we can show all of the corresponding links. Okay, this is an example. This is what I was saying. You can not only see, for example, the nitrogen forecast, but what is the forecast for that specific monitoring station in terms of temperature? So we can talk about with Oscar about this. How can we compare this data with the monitoring stations and then carry out an evaluation? Precipitation, for example, is something that we have not used yet. But this is how those forecasts would look for air quality, in this case, the Ipodaca monitoring station. And here we can see the levels in terms of concentration. And I think this is the last one. And this is what I wanted to talk about. This is not only to communicate to the general population. In Mexico City, they developed a model that using data from the health sector in terms of people coming into hospitals for asthma or for respiratory illnesses, this data alongside the forecast allows for people that are in this category to know that tomorrow there is going to be a level 8, and if I have problems at level 7, and maybe if I have asthma, I will end up in a hospital if I have a level 6. So this allows for people that are susceptible and are vulnerable, and people that are care for these vulnerable populations know what to do. Perhaps there can be some actions that reduce emissions that could help to avoid a high level pollution event. But if I am vulnerable, perhaps I can stop exposing myself to these pollutants. This is something that we can know from CanAIRy Alert. If one day before you tell people, tomorrow we will have a level 6 or level 7, so they can act accordingly and we can stop people ending up in hospitals or hospitalized. So this is just an idea. This is another potential use of this forecasting tool so that other health agencies can actually take advantage of this data. Thank you. In the next panel, we are going to talk about the development and use of tools that protect people's and ecosystems' health. And just as a summary, we have been talking about the transit from one vision to the next, how to take into consideration atmospheric conditions, to move from sectorial approaches to interdisciplinary approaches. And for that purpose, it is very important to take into account the health aspect. The health not only of populations, but also ecosystems, as mentioned before. In this sense, then, the question for Dr. Jessica is, taking into account this transition from the sectorial to the interdisciplinary, how do you think that the managers of public health can integrate and use tools like this one for the development of strategies for population health? And another question, a little bit more complicated, is how can we effectively communicate these strategies to the general population? Talking about governance, for example, how can we effectively communicate this to the population? Okay, thank you very much. Can you all hear me? Perfect. Well, thank you very much for the questions, and good afternoon, everyone. Well, this topic is definitely very interesting. As you might remember, last year in 2023, we experienced one of the lengthiest heat waves. We had the summer solstice, which was a very, very hot summer, and you've seen these statistics in terms of cases and mortality. And all of the systems and projections that we could have will definitely be useful. Understanding this context and also to create a forecast for the next 5 or more years where we expect an increase on temperatures and in our city so that we can prepare in a more intersectorial way, so that we can develop plans with other areas, of course, in this case with civil protection and the environmental agency, and of course inside the Ministry of Health and other institutions. Because of course my area is in charge of systems and the epidemiological data. I can tell you what happened, but before that, what do we need to do to prevent all of this? So we need to talk about prevention plans so that we can reach the most vulnerable and most at-risk population in all of these areas that we, I believe, have very much identified all of those populations and how to work with them. So I'm talking about the elderly population. And this is a very important topic that you were talking about, communication, because sometimes you come to the population and you tell them that, I don't know, maybe a person that is working on the street, maybe a construction worker, even our police officers, they are the ones that are at most risk. And when we're at home, we feel safer. But the most vulnerable person is actually an elderly person or a kid or children that have comorbidities, because of course we see this type of different comorbidities, maybe hypertension or smoker or something like that. This is a person that will dehydrate and decompensate faster. And most people, most younger populations are actually at work and they are not thinking about this specifically. So we need to create plans so that we can reach better these populations. Perhaps the people that take care of the elderly, and also communicate this to the hospital staffs and also from the first level of care, and train them in terms of the most timely medical care. And we also need to think about how to bring these patients as fast as possible to a clinic so that they can receive the care that they need in a timely fashion. Thank you very much for that. Now we move on to Armandina just to wrap up. Armandina, could you share some experiences and current challenges that you faced institutionally in terms of communicating these studies, not only to the population, but also to decision makers? Thank you very much. Sorry, I'm a little sick, but thank you very much for being here. It has been a very interesting event. Thank you to WRI for this opportunity to share our experiences with this group. We are very grateful for all the support that we've received. Well, we do have a lot of challenges, all the way from monitoring, which I believe this is step 0 for me. It is very important to have complete and quality data in all of the stations, and we have been working hard to make this a reality. So here we have the coordinator of the monitoring stations, Jaime de la Garza. So he is in charge of operating this network. He is an international acknowledged expert. We have Gerardo Arguin, who is in charge of publishing this data, Heriberto, that validates data and creates reports. All of the platforms that we have been internally developed. So all of that is a challenge to get the data, to validate the data, to make sure it's of good quality, to communicate it timely. We have stations operating 24/7. We, of course, have areas of opportunity and errors. And I mean, you have no idea when we analyzed all of what could go wrong in this process. We are measuring 16 different parameters continuously per station, and they are not measured every hour. They are measured every second. So if we get data every second to get the corresponding averages and to do the validation, and then to get the corresponding index that need to report as per the standards. Actually, we just changed the standard, and the standard has been published from July 23rd, and we are applying this new norm. So it is a big challenge to get the data and then publish it correctly. And this is so technical in terms of data. We have here wonderful people here from civil society that are very much paying attention, and also people from the industry paying attention to this topic, that we are now experts in all of this. But how do we communicate all of this technical data to the general population? That we have a problem, the air quality is terrible. Be careful, take the following measures. And schools, for example, we have been working with schools so that they can suspend their activities. And in schools, what they tell them is that, I mean, yeah, we have an air quality alert, but we are not going to stop our activities. In, for example, in sports leagues where students go, and many of them might have asthma or other respiratory diseases. So it has been extremely difficult to communicate these risks to the population. We are communicating this information all of the time in terms of the norm 172, where it states what the risks are for general population and for vulnerable population. This is something that is continuously on our website. We make recommendations of what can and can't be done. We cannot prohibit people to go out or to do barbecues or to use their cars. We cannot prohibit that. But we can create awareness, and that is a challenge. It is a big challenge to bring this communication to the general population and to become aware of it, because there's a lot of people that smokes, starting from there. Of course, cigarettes emits PM 2.1. So how can we make the general population more aware of perhaps not using fireworks, for example, on those days where the air quality is most terrible? So it has been a big challenge indeed, but we appreciate the fact that we have more allies now. We appreciate the support of people like you that are here today, that are committed, that are carrying out actions continuously to improve the air quality, and that help us to communicate this to the population, that air quality is so important. And these are organizations that have credibility, and they have been of great support to communicate these facts. So another challenge has been the response of the program of air quality, and I hope that we will see more results soon. So thank you very much for all of your support, and we will continue working on this. This is part of the PIGECA. It is part of our plans to continue improving our management tools, and this has been a wonderful tool to tell that the air quality is bad not only today, but also to make a forecast for the next 4 days, for example. So these forecasts are critical. As I was saying, measurement is step zero, monitoring is step zero, but these tools helps us to avoid risks and to take action in the short term. Thank you very much. So what I'm listening here is the importance of promoting a culture of self-care based on data, and also to support each other in these governance mechanisms, as we were listening before, in order to strengthen and also pressure. Okay, so now we will move to Q&A from the audience. We have a few minutes for that. Thank you very much. Well, my question is about the work that the Ministry of Health has carried out. And I think that it is very important to acknowledge that we are working currently on a health surveillance pilot program. And my question is about that specifically. How can we, from civil society, how can we know how this surveillance system works? How can we support in the effort of it being used in the population, and so that they know that this surveillance system exists? That on the one side. And also, what is the role of the Ministry of Health in the contingency response plans. What is your vision, or whether you have a vision already established from the ministry in this regard, or have you thought about your participation there, or are we still working on that? Okay, yeah, so we have been actually sharing workspaces with the Public Health National Institute, and I think that's why Selene knows about this, of course, right? So, for example, from the epidemiological surveillance systems that we have been using here in this state, when we know that there's a federal norm, we have some special and conventional systems. And so, as we were discussing before, everything related to air quality and pollution from the national level is something that doesn't exist, but we can look at what Mexico City has. And they work with a conventional surveillance system, but unfortunately, the problem with this is that it has a lag of 2 weeks. So that it responds to recovering the data, collecting it, and analyzing it, and then sending it to the environmental monitoring system. So in order to avoid that, what we wanted to do is to have daily information, but from the health related units. So we are not going to bring or take this information from the conventional surveillance system because it has this 2 week delay. And the ministry wants information that is as close as possible to the date. So we have been working on this and we talked about this with the Institute. So from this 3 monitoring stations, we selected first level health units at 3 kilometers. And we will be using that for a diagnosis for respiratory problems in order to correlate that with the data that the Ministry of Environment is publishing as well. So as we heard before, the issue of public and private hospitals as well, because we know that there we see patients that come with some acute problems and chronic problems, so that we can also have that information included. So that's what we're working on right now. Actually, in recent weeks, we have been working hard on that. We are still working with the current data. And actually, this system was created at a state level. We are working with the IT department so that we can automate it, so that we can have this available on the platforms instead of filling out paper formats and passing on that data. So with this information, we will have more precise data for correlation. So we're working on that. I hope that we get good results, that we can get the data that we need so that we can fine tune it. Depending on the results, as you know, we need to analyze it and fine tune it so that we can eventually have data not only for us at the governmental level, but also at the population level. And as we've seen all of these projection systems that we have, this will be useful for that, so that we don't only use the national projections from CONAGUA or other agencies, which of course are important because we know that this can vary depending on the geographical area of the country. And the idea is to continue working on preventative plans for the general population, to issue recommendations, and eventually migrate towards next steps. As you were saying, what are we going to do in terms of how to impact the general population's health, which is eventually what we actually want to do. Okay, this is very related to Selene's question, but I just wanted to add a different spin to it. So you were talking about self-care based on data, and of course that is very important in terms of taking care of ourselves in due to climate change, and I believe that we have monitored very well the deaths around climate change related issues or heat waves and stuff like that. However, if this is not related to air quality, if it is not linked to air quality, as Beatriz was saying, this is something that could be deadly for a lot of people. So when we know this data, that have been, as you mentioned, delayed for 2 weeks, this will not allow for a correct forecast, right? So I think that what actually saves lives is data, it's information. And what will allow us to provide this information to the population is not only statistics about the deaths that already occurred based on the bad air quality, and we can assume that this many people died due to this cause, which of course can be exacerbated on a climate change context. So it's not really a question, it's actually kind of a request. The doctor mentioned some efforts to link respiratory illnesses with bad air quality with data. And I think that here it's an issue of forecasting, linking this to air quality and to creating a forecast. Not only data that is delayed, but how to work with this tool that Beatriz showed on screen, whether this data can tell us that the next day we will have a 7.8 or an 8, and sometimes it's just 4 points for a person that stopped breathing. So if we knew the number, the exact number, that could save their lives. In many cases, these deaths are not related to heat waves, it's not related to air quality until someone comes in and actually makes the connection. What we've learned today is that this is a problem, and it is important that you also work with us to link this so that we can provide a forecast to the people as a prevention tool, not only a statistical tool. That's my request. I'd like to respond to that. We have been working on the analysis of statistics for some time now so that we can create dispersion maps where we can see what can be expected based on the forecasts. Right now, for example, we already have a forecasting tool for air quality thanks to WRI's support and NASA, that we are requesting PM10 forecasts because this will be very complementary to what they can deliver based on the platforms that we also use. So we hope that with this support we can strengthen this collaboration, and getting this continuous data of what is happening is going to allow us to link those two causes. So if this is happening, what can be expected? What can be forecasted next? That is the objective. That is the purpose. And our objective is in health and air quality to have these dispersion maps of the metropolitan area of what can be expected per season. So eventually, we just need to get more data. As the doctor mentioned, we don't even get the data as we need it in the format that we need it. So we need to get the data in the same way that we get it for air quality, because this is not the way that it's analyzed. So this is the work that we've been doing. We've been working on this for years. There was a retrospective study. We didn't have the data for PM 2.5 for all of the stations. You know that. Currently, we have the equipment, we have the statistics that will allow us to get to that, what you mentioned. So that is exactly where we want to go. But we need to go through this stage so that we can actually reach what we need. Thank you very much. Thank you very much to both speakers.